Hi, and thank you for your interest in Fruit Street. Thank you for taking the time to watch this video. In recent weeks, with the COVID-19 uh, virus, we have heard quite a bit about telehealth, telemedicine. Fruit Street is a telehealth, telecare, telemedicine platform where many realize that we do deliver the CDC's National Diabetes Prevention Program, of which we have received full CDC recognition. We've been delivering the program for 3 years. We also license our platform to healthcare providers, physicians, dietitians, virtually any area of specialty, even educators, fitness trainers, health coaches, wellness coaches also use Fruit Street for their own telehealth, telewellness initiatives. So today we're going to take a look at some of the features and functionality that come with Fruit Street from a licensing standpoint. This would not be participating in the diabetes prevention program or our weight loss program, but rather licensing the platform as a healthcare provider to manage your own practice and to see your patients or participants, members, students, what have you. So on the Fruit Street homepage, I go to login, and I'm already logged into one of our demo accounts here. So once I do log into this healthcare provider account, you'll see the healthcare provider's name is in the upper right corner. In the upper left corner is the Fruit Street logo. This logo can be replaced with your logo or your name. The platform is completely white labeled, so you can change that so your patients, participants, members, students know that they're in your practice or in your classroom or in your company. On the main dashboard, which is where we're at, we see we have a waiting room. If anyone was waiting to engage in a HIPAA compliant video telecommunication session, they would be waiting right there, whether it's one-on-one or if you were facilitating a group. That would be completely at your discretion in what kind of services you offer based on your area of specialty. Over to the right, we have the day's scheduled events. In the lower left corner, we have real-time online tech support, not just for you, the healthcare provider, but for all of your patients or participants or members as well. Next to dashboard is patients. This could also be members, students, participants, customers, clients, what have you. That's also completely your discretion. This would be a listing of all of those folks that are in our practice. How do they get in our practice? Well, we would invite them by pressing the blue invite button over to the right and typing in their email address with any associated categorical tags and invite them to your practice. We could also search for members, patients, participants, students in the search box. Down below, we'll click on one of these patients we have in this practice, and we can see that this member, Adam, is offline, but we get some cursory information. Over to the right, we see we have chat and a video call, so we don't need necessarily an appointment. We would be able, if he or she were online, we would be able to engage right there in a video consultation. When we scroll down into this patient's health portal, we can see health trackers. That would be one of the unique features of Fruit Street is that we sync with wearable devices for remote patient monitoring. Currently, we sync with Apple Watch, Samsung Health, all Fitbit products, iHealth Labs, blood pressure cuffs, and glucometers and scales, Withings, and I feel like, and Body Trace, of course, for the scales that we use with the diabetes prevention program. So if anyone did have a wearable device connected, we would be able to monitor their data. And I don't think we have one connected to this. There was one that was connected back in November. I think that was an Apple Watch. At any rate, so we have a series of tabs, health trackers, goals, where you can set goals for your respective patients, participants, students, files. You can share files with them right through the privacy of their HIPAA-compliant health portal, so that when they log into their health portal, any documentation that you've made available to them, they would have access to. Similarly, they would be able to share documents back with you. And during a video teleconferencing session, you can do screen shares. Both can do screen shares, so you can share documentation that way as well. Visits is a chronological breakdown of all the visits as well as any session notes. Questionnaire, upon intake, everyone that you invite to your practice, they would complete a questionnaire, typically height, weight, medical history. You can turn off the questionnaire if you don't want to have a questionnaire. That's at your discretion. And then finally, we have devices, any devices that are connected. And as I mentioned, Fitbit, iHealth, Body Trace, Samsung, Apple, and Withings. So any of those devices can sync with the platform for remote patient monitoring. Next to patients, we have calendar. Calendar, you can set up your calendar of when you're available to see patients. You can also schedule appointments with them. You can open up times of your availability where the platform will act as a virtual receptionist, scheduling appointments for you, where patients would be able to pick the time that they would like to meet with you based on your availability. You can also just schedule an appointment for them, whether it's a one-on-one or if it's a group. If you're having a group call, you control all of the different types of visits and sessions and services that you do provide. Next to calendar, we have visits. Visits is a listing of upcoming or impending visits that are scheduled, as well as those that have transpired historically, along with any associated notes. Moving right across the top from left to right, we have the question mark, which is customer service. You can call our customer service line, or you can email support@fruitstreet.com. And that, of course, is in addition to the real-time online tech support that we provide, not just you, but for all of your patients, students, participants, members as well. Next to that, we have the notification indicator, which is in the bell icon, which lets you know all activity that's happened within your practice, and everything is time date stamped. So if someone takes a picture or shares something with you, it would be time date stamped, and they can do that by downloading the Fruit Street mobile application onto their phone or tablet or other mobile device. Next to the notification indicator is the message manager, where you can message your respective patients, participants, members, and you can also create groups so that your patients, participants, members, students can talk amongst themselves as well, using either the Fruit Street mobile application or a laptop or desktop. Notification, the Audible Alert can be off or on. If it's off, it's muted. If it's on, every time someone enters my waiting room, uploads a photo, something happens, I would receive an Audible Alert letting me know that I should pay attention to something in my practice or my company. Finally, we have the drop-down menu under the provider's name. My Practice allows you to set up your practice, where you can put your credentials and who you are. After that, payment settings. If you want to charge for any services, you can connect Stripe to process credit cards right through the platform. It syncs with the platform seamlessly. Down below, waiting room settings, we have the ability to create our waiting room and the different types of sessions or services we offer, their duration, description, whether there's a fee associated with it, and whether it's one-on-one or group. You can create unlimited visit options for your practice. Next to payment settings, we have the questionnaire preview. As I mentioned, the questionnaire can be on or off. You can also customize the questionnaire if you have other questions that you'd like to ask, aside from the standardized questions that we include. And then we have account management. Account management allows you to customize your practice, your company, by putting in your own name, putting in your own logos, privacy policy, terms of use, all at your discretion. Next to practice visit options and payments, again, The only visit option that we don't have currently turned on would be walk-in, would be like urgent care, and you could turn that on and just go down to the bottom and hit update, and folks would be able to sign up for your practice, and provided that a provider is available, they would be able to immediately engage with your practice. Stripe, of course, for credit card processing. Health settings, you can turn on and off any of the devices. You can also prefer certain devices. That's all at your discretion. Next to health settings is billing. Billing is just the subscription that you have, and adding providers as well as exporting your patients, their list, and basic data. And then files, we have a master file sharing utility where you can share, if you have 1,000 patients or members or students, or you have students and they're all studying the same curriculum, you'd be able to upload a file here and it would be shared across the entire swath of your database. So that is a demo of a provider account. Very simple, very intuitive. We provide around-the-clock customer support and service. And if there's any questions, we're also offering a special pricing per provider. So let me know if there's any questions. My email is james@fruitstreet.com. You can also call our main corporate line, 347-960-6400. Again, thank you for your interest in Fruit Street, and we hope that we can help you to help others.